Today we're going to talk about the thread lift, an increasingly popular cosmetic procedure with A-listers and everyday folks alike. It's increasingly an alternative to the more traditional facelift, and I'm speaking with Dr. Mike Shenouda, who's a cosmetic physician from Géniale, which has clinics in Sydney and the Gold Coast. Hello, Mike.
Hi, Jane. How are you?
Very well, thank you. So, Mike, perhaps you could start by telling us what's the difference between the traditional facelift and the more modern thread lift?
The main difference is the dramatic result.
Okay.
Surgery is dramatic change, and thread lift is a subtle change.
Okay.
Refreshing the face, it can take back a few years with 2 hours of procedure, and you can go to work next day. Compared to surgery, the downtime is 2 to 3 weeks, plus the possible complications of surgery.
I guess the other reason is, what about the actual results themselves? Can they be changed at all?
Well, with surgery, you cannot, because you've cut skin, compared to thread lift, which we can add threads. The threads will dissolve. So if you're not very happy with the results, this can
It's
be
not permanent.
shaped. Yeah, it's not permanent.
Yeah. And how long do the results typically last for a thread lift patient?
So for a face thread lift, we expect 18 months to 2.5 years. Compared to surgery, it's permanent.
Mm-hmm. When you say permanent, does that mean 5 years, 10 years?
Well, permanent depends on your aging process.
Mm-hmm.
But I would say you can get 10, 15 years out of surgical facelift unless you age and you lose weight rapidly.
Okay. So what about the suitability of patients? Would there be certain patients where you say, yes, a facelift is better for you and a thread lift might be better for you?
Certainly. So the actual volume of the face tissue is important. If you don't have enough volume, we cannot do thread lift, but we can do surgery. If you have excess skin, then the skin has to go somewhere, which is surgical.
Yeah.
So patient selection is mandatory to achieve the best results for each patient.
Okay, so in your experience, what kind of women is the thread lift suitable for? Who's getting it done?
Yeah, so we see all ages and depend on where are the sagging part of the skin and the face is. So the area of the nasolabial fold is the most common, and then become around the mouth and the jowls.
Yeah, that is a nasty one. I always go like this. I do this, pull my hair back, instant facelift. Wouldn't that be a great procedure?
Yeah, so these are the most common things. And again, it's they look at their mum and aunties and say, I don't want to look like that. And they come early enough to prevent it from happening in the first place.
Is it a repeat procedure you can have again and again and again? Are there any side effects?
No, really. It's a surgical thread that is very well tolerated by the body. It's not rejected. And we can add to it. So we have patients coming back say, well, look, I'm due for a top-up. So we can top up around the mouth or around the jowls. The neck is a very successful thread lift as well. So the saggy skin can be lifted to the sides.
What parts of the body can you do it? You do it on the face, the eyebrows, the neck, anywhere else?
Yes, so eyebrows, the very trendy now, the foxy eye lift, and lifted the tail of the eyebrow, and that to give you a nice almond-shaped eyes. It can help slightly with the hooding of the upper eyelid when you lift the eyebrow, and it's very attractive and very much in fashion.
Okay. Are there any medical considerations as well, perhaps with vision or any issues medically that it can improve?
Look, if it's affecting vision, we're talking about surgical blepharoplasty and removing the excess skin, because we don't expect a thread lift of the eyebrow to lift the eyelid that much if it's that sagging. Threads can be in the nose, so the non-surgical rhinoplasty, it's a very effective, it's 20 minutes procedure, and it straightens the nose.
Oh, wow. So it can get rid of a bump in the nose?
It gets rid of the bumps of the nose, and it increases the bridge of the nose. It lifts the tip of the nose. So it's the easiest procedure to have a pretty cute nose.
Okay. And does it always work? Like if it's a severe bump, will it work?
No. So again, patient selection is essential for us. So deviation of the actual nose cannot be fixed, but we can mix the threads and fillers to get the best shape outcome. But also not for everyone.
So, Mike, what are the side effects of a thread lift?
Infection and bruising are not common, are rare occurrences, but certainly to be considered. It's under complete sterile technique, but still infection is a possibility because it's actually invasive to the skin.
Mm-hmm.
Bruising is a second concern, but this is all temporary and it resolves within a couple of weeks.
So what about the sutures themselves? Are they TGA approved? What are they made out of?
Yeah, so they are TGA approved. They are very similar to the surgical sutures we use internally in any procedure. And they dissolve between 3 to 6 months, but the actual if lift remains. And the lift happens because it's got cones. So when you lift the skin of the face, they are anchored on these cones, and you don't need to do any incision or any sutures or actually nothing.
So the cones aren't dissolvable, but the sutures are?
The cones and the sutures dissolve.
Okay, so when they dissolve, does your skin flop down again? Or?
No, so the collagen will build. So it's like gluing the skin to where you leave it. So when you do the lift, the skin will remain there and stays there until the aging process will set in again and we can repeat again the procedure.
Okay, wonderful. Well, thank you very much. Today we're talking to Dr. Mike Shenouda, who's looking
Thanks, Joanne.
at the thread lift.